Hey, it's Joe Lamb, and this is Monday Afternoon Coffee Break with Joe Lamb and Michael Stone. I'm coming to you from the Personalized Lifestyle Medicine Center by Metagenics in Gig Harbor, Washington. And Dr. Stone, when he gets signed on, will be coming to you from the Stone Family Medical Clinic in Ashland, Oregon. It's good to be with you today, and I hope you had a good weekend. We have been doing a lot of thinking and have been talking about how we give care in the United States. And Dr. Stone and I talked about this earlier today. So when I say we've been thinking, it kind of reflects both of us. But these comments are coming from me, and I want to take full credit for them. I am distressed by the care that I see some of our patients getting. It's novel to recognize the fact how often I look at the care that other practitioners are delivering and how often I find that care to be subadequate. Here's Dr. Stone. Michael, I brought up the concept of care and deficiencies in care, and had just gotten started. And I was just saying, I was distressed by how often, when I look at the care that patients have received prior to seeing me, I'm surprised at how yours and mine profession seems to have left the building before it was time.
Yeah, I wonder if it's the adopting algorithms without seeing the patient, right? We know that algorithms are set up to catch 80 to 90% of the issues. And for 80, 90% of the time, the algorithm is a good place to start. But if the algorithm isn't working, do we have the lever to pull? Can we take a reflective step back and be honest about the patient is not changing how they are their condition? And maybe we're in the wrong algorithm, or maybe the individual, because of their uniqueness, doesn't fit the algorithm. And I think that's where wisdom comes in, knowledge, experience, and insight. And algorithms don't necessarily promote wisdom.
No, in a sense, and we talked about this, and now I frankly can't remember which of our Saturday mornings we talked about this, but the concept of heuristic. An algorithm is a heuristic, but it touches upon providing someone directions and yet providing them blinders. So much trust or so much responsibility is given to the algorithm that you don't look beyond the side of the algorithm. You don't look at your journey as you're moving forward. And what does that really mean, right? Because, heuristics are supposed to make it easier for us to do things with excellence. And, unfortunately, I think that, algorithms, or, as people frequently want, like cheat sheets for how they practice, or recipes for how they practice, or, flow sheets for how they practice, lead people to only see and answer the question that's answered, and doesn't leave much room for nuance.
No, I agree with you there. And I think that the habit of having to know or believe you know, the egoic drive to say, I know, versus I'm uncertain, versus I do not know, I think is an interesting challenge for clinicians, right? And one thing that one of our mentors, David Jones, used to do is he would say, and I saw him do this in clinic, he would say, I need to step out and I need to go find Dr. Brown. And he'd step out of the room and wait a minute or two. And then he'd come back in the room and he'd say, hello, Miss So-and-so. I'm Dr. Brown. I would like you to tell me your story. And in many ways, he was taking a step back, trying to let go of everything he thought he knew about the situation, and then came in and tried to hear it afresh.
Yeah.
And hearing it afresh, allowing the adaptive, allowing the owner to bring forward their story again and the new patterns they saw is not something that we are allowing ourselves as clinicians to do frequently enough, I believe.
Well, I would agree with you. I think we have a lot of inherent wisdom. And if you give the patient enough time to talk, they may actually be able to tell you what's wrong with them, or at least point you in the right direction. But the difficulty becomes that our system, whether you want to say it's partly physician greed, or you want to say it's insurance company greed, or if you want to say it's politicians who are cowards, or whether you want to say it's employers who want to say they're giving you something when they're not, whether it's us with our mutual funds owning part of the insurance companies, all of us, in our retirement plans, having mutual funds that own insurance companies and being tied to the insurance company making a profit. All of these reasons are keeping us from coming up with new solutions for what we need to do, and thinking outside the box, because clearly what we're doing at the moment is frequently broken.
Yeah, so it'd be interesting, anybody who's listening, just type in the chat, what's one thing you'd change if you could? If you could snap your fingers, what's the one thing you would change? What is the access point that would help you in your health journey versus in many ways being told what to do by whatever level of interaction you have with the medical system? Is the medical system expected to do anything more than just the acute issues, the broken bones, the lacerations, the sudden heart attacks or stroke, the motor vehicle accident, the dealing with somebody who suddenly went unconscious? Or should it be a health system that we've talked about many times? And how do you meld the two? I think one of the interesting things, Joe, is some of the work that you're doing, and you're trying to quantify and also try different techniques to help people change behavior to a more healthful set point for them. And our system's not set up that way.
It's not, and really it's work you and I are both doing, because we're both lead investigators on the Lifehouse Study, Lifestyle Intervention and Functional Evaluation, a health outcome survey. So, we're working to define that territory, right? We're working to identify how you define health and how you promote health. And but it's fascinating that before I comment further about that, when you asked the question, one thing you would change, my immediate first response to that was going to be, hey, term limits for politicians. But you were asking what one thing I would change in regards to my own individual health. But I think you're right. I mean, we talk about health, we talk about what our goals are, but we're also talking about and someone just commented, so let's see what they said. Nope, they didn't comment. Sorry, just can't see. But there's the whole piece of what is the promotion of health, and how do we deliver it, and where did we deliver it, and is a behavioralist approach or a biohacking approach suitable for the more challenging issues in terms of lifestyle?
Yeah, that is a great question. Is the biohacking suitable to lifestyle change? Some aspects, isn't it? You wonder, what is the leverage point? What is the weight on the scale that will convince people to change, or help them see that they have the power to change?
Absolutely.
That is an age-old question, and I think it's very individual.
Yeah. Well, it's funny. Jeff Bland was asked kind of the flip side of this question, right? You just asked each individual what they would do for their personal health. And Jeff Bland was once asked, he's the founder of IFM. He was the chief science officer here at Metagenics for years. He's, the president of the Personalized Lifestyle Medicine Institute. But Jeff was asked the question, what one therapy or what one thing would you give each patient if you had to pick one thing? And he was very quick with the answer, which surprised me. But it was because he had thought his way out of the box of one size fits all. And his answer was, I'd give everyone an extra hour in their day. So the person who needed to be mindful about their eating and their meal prep and working on their food plan had an hour to cook whole food and eat it. The person who needed to exercise had an hour to exercise. The person who needed an hour to work on their relationship, or the person who needed sleep, or the person who needed recreation, or the person who needed meditation, whatever it may have been, they all got it. And I thought it was a novel answer. And it speaks to, it really speaks to that part about function and balance and modifiable lifestyle interventions. Because, it doesn't take you an hour to suck down a nutritional supplement. It doesn't take you an hour to take medication or a shot or, whatever. But it takes an hour to do all the meaningful things, which are actually lifestyle changes.
Yeah, and that's a great point. And then you start thinking about, okay, so is there an hour in my day that is in 2 or 3 minute segments? And I like to, Emily Ridbaum, our daughter, who's a nutritionist and educator, her big thing is to have people do balance exercises while they brush their teeth. You're close to a counter to stabilize so you don't fall. You're brushing your teeth. That takes a minute or two. And we know that balance and doing neurologic actions, neuromuscular actions, need to be practiced again and again to form new nerves. And so she's gotten most people in our family to sit there as we're brushing our teeth, try to stand on one leg, and then try to shut your eyes for a second or two to work on your proprioception. What is the 2 minutes, Joe? I know you do this with patients. What is the 2 minute or 3 minute exercise to travel the last 10 steps to their favorite place that helps you reset your sympathetic parasympathetic system?
Right.
What are the 2 or 3 minutes, 2 to 5 minutes before you shut off the light, that at night, where you could practice or consider the things that you have gratitude for? What are those? Does it take more than 10 minutes to make a morning smoothie? So, what I found myself trying to do in the last few weeks is trying to mindfully identify a minute here, 2 minutes there through the day that I can incorporate just a couple things that I know help blood pressure, arrhythmia, health.
Oh,
So what are those things? Yeah, what's that challenge?
well, one of the things we do is the mini relaxation exercises. Like taking just a few deep breaths. There's a lot of wisdom in that count to 10, before you do whatever you're about to do. Throw a punch, shout an expletive, jump off the bridge, count to 10, take a deep breath. All of these are accessing the body's ability to talk to our physiologies. And, we talk about it in our teaching programs, the ones we do in our healthy transformation class here, and the ones that you and I do with our consilience programs about stop, breathe, reflect, and choose. So stopping is being mindful enough to have the awareness that you're feeling a little bit different. And that comes out of, practicing what it feels like to be calm or to be attuned. And then breathe is, okay, if I'm not in my calm state, I'm going to breathe long enough to get to my calm state. And then reflect, think about what choices are available to me at the moment, and then choose. And, it changes, everything that we do. How often can we make a quick response to somebody and realize after we've made it that they may be getting ready to make a completely different choice, or we're getting ready to make a completely different choice, but we don't do it because we didn't stop.
Mm-hmm. No, I agree with you. I think all of us in the last 5 years have been given multiple opportunities to practice that. And I think that I myself have failed more than I've succeeded. So it's a good reminder. I also tried to started reflecting on, can I let somebody get through their statement to the point that they made, whatever point they're making, without interrupting? Zoom calls have made me acutely aware of my tendency to interrupt. And it's important to allow people to say their piece, and then to stop, breathe, reflect, and choose,
Right.
So.
No, I feel guilty of the same thing on Zoom calls, and you can't really follow particularly if you're on a Zoom call with, like you and I can see each other fairly well right here, right? So we see our body languages, we see our cues, but we're only looking at two faces on the screen, and only having to focus on one of the other ones. I'm scared by my own face when I look at it, but I can look at yours and figure out what the cues are and what I have to respond to. But if there's 12 people on there, how do you get a turn? You raised your hand today, and it took one of the other attendees to get the moderator to notice that you had raised your hand. You were standing there like this.
Yeah.
Yeah.
That's true.
And it went on for a while, and you actually even froze for a little bit in that position. So, Ring Central was trying to make it easier for you, so you didn't have to hold steady. But you're right. I mean, communication is about hearing the whole need sometimes, and we're often guilty of taking, and this comes out of David Byrne's work, the 10 cognitive distortions, but one of them is guilty of being a mind reader, right? So you start to say something and I go, I know what Michael's going to say. So I'm all ready to jump in there and say the next part of it, and it may not be what you were going to say. And you may have had no intention. And sometimes we really have to dig, because people may not be saying what they want to say, because they're trying to protect. I learned from a friend's father that playing Huck Finn, or maybe it was Tom Sawyer, with language works well. But after a while, you start realizing it may work well, but it's manipulative. Like, hey, John, I'm going to let you drop off this phone call, when what I really want to say is, hey, John, I need to go, right? That would be a non-conversation. I'm going to let you drop off this telephone call. And they go, oh, well, thank you. Duh.
Yeah.
And that becomes, it's partly being kind of fully out there and fully expressive, and kind of fully trying to get to that next level of communication with somebody. It's fascinating to me how many cognitive distortions there really are, and how they make a difference in our day, and how we can overgeneralize. Back to that telephone call we were on, the research telephone call we were on earlier today. I made the comment shortly before you got on, like, happy Monday. And everybody was like, what do you mean? It's a Monday, right? And that's like going to color the way we view that day, right? If we expect it to be bad, the first thing that happens confirms that it's bad, and then we can't see the good the rest of the day. That overgeneralization, another one of the distortions on Burns's list of 10.
So circling back around, can we use any of this to improve the encounter with people who seek answers about their care and their health and their well-being? And probably one of the first things is stop, breathe, reflect, and choose to ask the next question without interrupting. And this comes back to one of your earlier points of how often do we sit and listen attentively without prejudgment, without the ESP of what they're going to say, so we don't come in and interrupt. And those are 2 points that I think, if you're in an emergent situation, a real emergent situation, the and most of us will maybe see one really emergent situation a year in our clinical practice. Most of the other ones are smoldering or slowly moving, right? And so we are afforded the luxury of time to listen. And even if it is an emergent situation, we do well to allow our senses to pick up and to begin to identify the next emergent step. So, what else in that list is directly applicable to our clinic practice?
I think knowing what your goals are going to be is kind of important at the start. Trying to figure out where you're going, right? What the first steps are. Because I think that's, we're not always on the same page with the patient. Like figuring out why the patient happens to be there, right? I had an interaction today with a patient post-hospitalization, and at least part of the discussion was about her needing to be heard about what her experience was and needing to be validated. She wasn't looking for care in the traditional sense. Like I wasn't jumping in to deliver a new level of care. I was jumping in to, kind of say, those are legitimate feelings. And for me to recognize that I didn't have to fix what was broken. I did Google and find the Washington Medical Commission's portal for making a complaint against another physician, and I put it into her instructions so she knows specifically where to go. It's that was at least part of the visit. And then finally, we got to a different point in the visit, which was she needed some hard and fast information about her vaccine status and what she needed to do in terms of her vaccines post-hospitalization. And, then I had a different function to serve. But I think being clear about what it is that we're doing makes a difference.
Yes, I absolutely agree with that. Often the simple question, how can I help you today? Right.
Right.
And sometimes the answer is, I don't know. Sometimes the initial response is far afield from what the final identified response is. And that takes a little time.
Yeah.
And then it's responding without making it too many steps and too difficult,
Exactly. And it's also responding with, it's somewhere on that, what's the definition of a coach, right? Because, I was having this discussion with Courtney Suter, one of our co-teachers at Harmony Hill and Feathered Pipe, about where mental health professionals call the boundary of giving people advice and where practitioners call the boundary of giving people advice. And, I like to think about it as a coach. I was blessed by being exposed to Sleepy Thompson, who was the athletic director at my high school, and Tom Boswell, who's one of the big sports writers in this country, actually got in trouble years and years and years ago because he was at the Masters and he didn't write about the Masters par 3 tournament. Instead, he wrote Sleepy's obit. for the Washington Post and syndicated around the country. And the Masters was infuriated with Tom, but Tom had known Sleepy as a boy and then as a man, and Sleepy had died, and but Sleepy was a coach who was really there with you all the way, right? You know, like he was excellent at teaching you the fundamentals during the week. He was excellent at holding you to the highest standard of behavior. He was excellent on the sidelines. He could draw the X and O's all day long. His teams won. I mean, he took teams with limited talent and had undefeated seasons, right? Just incredible. And yet Sleepy was very active, right? Like, so, you know, he never, you know, the game started, he sent in his advice, but he didn't stop there, right? Like, you know, it wasn't like the kind of coaching that he set you up at the camp during the summer and then you got to go out and play your life, which is what it feels like sometimes when you're dealing with a psychologist or a psychiatrist. Sleepy, you know, short of running onto the field to make a tackle, would nonetheless be the loudest voice on the sidelines, screaming at the top of his lungs, "It's a pass, it's a pass, it's a pass," or "It's a run," you know, trying to help the defense know what was coming, right? And, you know, you could see Sleepy wanted to run onto the field to make the tackle, right? But he didn't do it, you know, and, you know, and, you know, and generally he was fairly controlled his temper, you know, sometimes better than I did. I was on the sidelines once and Sleepy was no longer head coach, but I remember this story. I'm standing on the sidelines next to the ref and I said, "Hey ref, I'm the team doctor." And he goes, "Why is that relevant?" And I'm like, "Because I have a prescription here for you." And I handed it to him. And it was like, "You need an eye evaluation." And he turned and looked at the coach and was like, "Get him to shut up or I'm going to throw him out of the game on a technical." And the coach just looked at me and said, "What did you say?" And I was like, "I didn't say anything. I gave him a handwritten prescription for an eye exam." We had been playing against Bullis and they called back a field goal attempt, said it was wide, and afterwards, looking at the film, it was very clear that it had gone through. And the worst part was we ran this really cool, neat, fake reverse, right? And the player with the ball was running into the end zone as the ref blew the whistle at the line of scrimmage to mark the ball at the line of scrimmage because the halfback had run into the line and gotten tackled. And the wide receiver who actually had the ball had run around the end, come from one side of the field to the other behind the quarterback, gotten the ball, went around the end and had gone 20 yards for the touchdown and was standing in the end zone as the ref was blowing the whistle to call the play dead at the line of scrimmage. And it was after that that I gave him the prescription. So
did they get the touchdown?
No, because he blew the ball dead at the line of scrimmage.
Even though the guy had the ball in the end zone.
In the end zone.
Yeah. I would have probably given them prescription and yelled to go see a doctor.
Yeah.
But I'm not sure whether we solved anything.
Well, I think what we solved is trying to be intentional in our listening, identifying that there are cognitive distortions which affect the way we think, recognizing that, you know, perhaps the patient can prepare for an office visit about being clear about what their goals are, and even if the doctor hasn't asked, stated them. And then all of us need to think, you know, first of all, about what we do to be advocates and gardeners of our own health. But B, what we also need to do to try to make it a healthcare system that delivers good care for everybody. and recognizing that we can't blame it on somebody else. We can't blame it on the doctor or the insurance company or the employer or the politician, because we're intimately related to all those people. And, as I said to you earlier today, I did a guided imagery exercise as part of the gut health series on mindful eating. And I finished the meditation with, if food is about social connection and about the importance of our communities, then taking it back to a physical level, we should be thinking about making sure that no person goes hungry.
And that's, you can say amen to that. So tell us about, with that, one encouragement for the next week is try to identify anytime you take a moment and smell something or taste a flavor that is connected to a memory from your past. And see how many of those you can identify. And maybe next week, we can talk about a couple of the hedonic senses, smell and taste, and how it plays such an integral role in our health. And tying back to what you just said, people who go hungry and don't have enough food don't have the opportunity to taste and smell enough. And
amen.
Anyway.
So thank you, everybody. If you find this sort of work fascinating on both YouTube and here on Facebook Live, we have 2 of the 90-minute Consilience Partnership videos recently done. If you're thinking about applying for a scholarship to Feathered Pipe, the list is already full, but you can still get on the waiting list for a couple days. So send in your applications. Some of the people on the waiting list will end up indeed getting a spot. So please do that. If you're interested and the scholarships are used up, we hope you'll join us. And we will be at Harmony Hill in just a few short weeks on the 11th of June. And we hope to see you there. There are some partial scholarships on a financial need basis available for Harmony Hill. As of Friday, I think there were still 3 of the partial scholarships left. So I hope you join us in one of those places as we explore what it means to live a healthy life.
Thanks, Joe.
Thank you, sir. Bye-bye.